The enjoyment, the pleasure from it is difficult to erase. And as a result of this, they want to keep on going back to have that similar experience. And any cue or triggers, there are what we call triggers. The trigger could be in form of person, place, or things that will make them remember that experience. They just go back into it. These triggers are available so much in their environment, and that is why you see them going back into it. So when you talk of approach in the treatment, there are a lot of things involved. You may need to manipulate, apart from the psychological intervention, you may need to manipulate the environment. You may need to do a lot of things for them to be out of this problem. So it takes a lot for a patient to recover from drug addiction. Thank you, ma'am.
Thank you very much, Doctor. We really appreciate you. I pray that the Lord will continually strengthen you. Doing this for us free of charge is a lot. I want to go to the comment section now and read what we have there. Blessings. Say thank you for this impactful information, sir. Counselor Fumi Adegboye. I read, most families are living in denial. How can a counselor convince that drugs do not make you a superb human against what the child had been told, probably by the parents or by the handlers around her? Please, if you have more questions or you are interested in knowing more about this, there's a number shared in the chat room. Please, you can contact us after this program. Thank you. So over to you so that you can answer the question, Doctor.
Yeah, thank you very much. That is why the counselors are there, the professionals are there to educate. And that's why I said we need to really have what we call school mental health program with their curriculum. With their curriculum, so that all these children, they will have knowledge about the drug of abuse and what it costs and how to prevent such. Because the pleasure obtained from the use or abuse of drug is just temporary. While they are causing those pleasure, they are also causing some damages in the mind. Our mind is in the brain. And it's more or less like a circuit. And once those circuits are disconnected, the person will not be useful for anything. So there is need for us to intensify education of the populace, creating awareness for them so that they'll be able to really help these young ones in getting the knowledge necessary to keep them away from drugs. Because once it started, if the problem starts, you need a lot of effort, evidence-based method to be able to get them out of drug abuse. Thank you.
Thank you very much for that, Doctor. We really appreciate you. Before I ask this question with me, somebody asked the question. I think Councillor Fumi Adegboye said that, okay, the porosity of the drug or substance in our neighborhood is alarming. What can we do, sir? Over to you, Doctor.
Thank you very much. That was why I put the approach to prevention into two. Demand reduction, supply reduction. Now, in the area of reducing the supply in the environment, the government has a role to play through the NDLA or law enforcement agents. The community, the church in the community, the ballers in the community, the youth in the community who know where all these things are being sold need to cry out so as to flush these people out of the community. This will go a long way to really help us. The drug bearers need to be reported so that they can be picked up and they can stop this their nefarious activities. So the environment needs to be sanitized and work on. This will go a long way to really help the environment or the society. At the same time, we must create awareness about this group of people, where they are, either on the social media or on the print or electronic media, so that they can be located and the source of supply can be removed from the community. This will go a long way to really help us. All the pharmaceutical chemists who are selling some of these drugs has to be monitored from time to time. We go there and check whatever they have in stock and confiscate any drug of abuse they have in their custody. All this will go a long way to really help the community to be free of this. So supply suppression is important. While we are also working, all the NGOs, all the various organizations are working on the demand reduction. Once we educate people about the danger, they will not go and be requesting for it. Once we also take care of the children at home, they will not be looking for some of this. So these are just my submission along this line. Thank you.
Thank you very much, Doctor. We really appreciate you. Please, let's use the virtual hand to appreciate him once again. I want to refer to some of the key points made by Dr. Owoeye while he was speaking. He said, apart from the statistics, he said drug misuse or drug abuse is a chronic disorder. So it does not go. So, and he said that every hand must be on deck, that every adult around children, around youth, the school, the church, the community, we should be responsible for this awareness, because it is not easy to manage this. I want to add this to what Dr. Owoeye had said. It is not cheap to manage this case. It is not easy. If you want to go to the neuropsychiatrist, it is costly, probably around 120,000 before you do test, examination, and all. You see a psychologist, you see a counselor, all of them are there. The drugs, the effects of the drugs. So he made mention of something that is very, very crucial. He said it is better they do it. It is better. This is why we need to prevent. This is why we need to keep creating awareness against drug addiction. Thank you very much. So lastly for you, Doctor, I want to ask that, is there any program put together? Because I could remember that in April, there was one by your organization, a neuropsychiatric Yaba, educating, empowering people, the passionate people, on how to create awareness, prevention, management, recovery, and all that. We don't know how often you do that. What can we do to get access? Okay, like professional counselors, psychologists, church leaders, so that we have more people who will be able to do a kind of who will be able to render a kind of first aid, and then they will now refer later. So how can we access such programs, sir? And is there anyone coming up soon? Or can we say, okay, do we have anyone coming up soon? Or how can we access such programs so that we can be empowered at least to give a kind of first aid before we refer?
Thank you very much. I am going to, because we normally do training. These trainings, they are in modules every 3 months, just to train addiction professional. We have an international certification with our hospital here. We call it a Colombo Training Drug Advisory Program. The certificate is recognized internationally. because going to, when we are having another program in the month of August.